Welcome to our channel. Today, we're diving into an important topic that affects many women worldwide, Polycystic Ovary Syndrome or PCOS. As a doctor I see a lot of conditions and PCOS is one that I'm particularly passionate about because it can be so effectively managed with the right knowledge. Now PCOS is a hormonal disorder that can manifest in a variety of ways, making it sometimes tricky to diagnose. We're going to break down the complexities of this condition in a way that's easy to understand and, more importantly, provides you with actionable steps you can take to regain control of your health. Whether you're newly diagnosed, suspect you might have PCOS, or are simply looking for more natural ways to manage the condition, this video is for you. We'll cover the ins and outs of PCOS, from the common symptoms to the latest treatment options and lifestyle modifications. Let's get started. So what exactly is PCOS? In simple terms, it's a hormonal disorder that messes with the normal functioning of your ovaries. Your ovaries are these amazing little organs responsible for producing eggs and hormones like estrogen and progesterone. Now with PCOS, your hormones can get out of whack. This hormonal imbalance can lead to a variety of symptoms, which we'll discuss in just a bit. But first, let's understand what causes PCOS. While the exact cause of PCOS is still a bit of a mystery, we do know that genetics, insulin resistance, and low-grade inflammation play a significant role. Think of it like this. If your body isn't using insulin properly, it can lead to a buildup of sugar in your blood, which in turn can trigger your ovaries to produce more androgens, a type of male hormone. These excess androgens are responsible for many of the symptoms associated with PCOS, like acne, excess hair growth, and irregular periods. It's like a domino effect, one thing leading to another. And here's the thing about PCOS, it affects women differently. Some women may experience mild symptoms while others may have more severe symptoms that impact their quality of life. But the good news is, regardless of the severity of your symptoms, there are things you can do to manage PCOS effectively. PCOS can be a bit of a chameleon, meaning it manifests differently in different women. But there are some telltale signs you should be aware of. One of the most common symptoms is irregular periods. We're talking about missed periods, infrequent periods, or even periods that seem to last forever. This irregularity is often a direct result of those imbalanced hormones we talked about earlier. Another common symptom is excess androgen, which can lead to unwanted hair growth, particularly on the face, chest, or back. And as if that weren't enough, excess androgens can also contribute to acne, even in adulthood. Weight gain or difficulty losing weight is another hallmark of PCOS. This is often linked to insulin resistance, which makes it harder for your body to use insulin effectively, leading to weight gain, especially around the midsection. Now, while those are some of the more visible symptoms, PCOS can also manifest in ways you might not expect, like thinning hair on the scalp, skin tags, or even darkening of the skin in certain areas. It's important to remember that experiencing one or two of these symptoms doesn't necessarily mean you have PCOS. It's always best to consult with your doctor to get a proper diagnosis. The good news is that PCOS is treatable, and the even better news is that treatment is often tailored to your specific symptoms and goals. One of the first lines of treatment is often lifestyle modifications. This can include things like losing weight, eating a healthy diet, and exercising regularly. These lifestyle changes can work wonders in managing PCOS symptoms and improving insulin sensitivity. Now, in some cases, your doctor may also recommend medication. This can include birth control pills to regulate your periods, metformin to improve insulin sensitivity, or even anti-androgen medications to address symptoms like acne and excess hair growth. It's important to have an open and honest conversation with your doctor about your symptoms and concerns so that you can come up with a treatment plan that's right for you. Remember, managing PCOS is a marathon, not a sprint. It's about finding what works best for your body and making sustainable changes over time. Now let's talk about some natural ways to manage PCOS. These are things you can incorporate into your daily life to help regulate your hormones and manage your symptoms. Diet plays a crucial role in managing PCOS. Focus on eating whole, unprocessed foods like fruits, vegetables, lean protein, and healthy fats. And try to limit processed foods, sugary drinks, and unhealthy fats. Exercise is another powerful tool in your PCOS arsenal. Aim for at least 30 minutes of moderate intensity exercise most days of the week, and don't be afraid to mix it up. Managing stress is also key. Stress can wreak havoc on your hormones, so find healthy ways to manage stress like yoga, meditation, or spending time in nature. And don't underestimate the power of sleep. Aim for 7 to 8 hours of quality sleep each night to help regulate your hormones and improve insulin sensitivity. Remember, these natural remedies work best when combined with a healthy lifestyle and, if necessary, medication prescribed by your doctor. One of the most common concerns women with PCOS have is their fertility. The hormonal imbalances associated with PCOS can make it difficult to get pregnant. But here's the good news. Having PCOS doesn't mean you can't have children. It might just take a little more time and effort. If you're struggling with infertility related to PCOS, there are things you can do to improve your chances of getting pregnant. Losing even a small amount of weight can make a big difference in regulating your cycles and improving your chances of ovulation. Your doctor may also recommend medications to induce ovulation, like Clomid or Letrozole. In some cases, in vitro fertilization, IVF, may be an option. The most important thing is to work closely with a reproductive endocrinologist who specializes in PCOS. They can help you explore your options and create a personalized plan to help you achieve your dream of parenthood. Weight loss can be particularly challenging for women with PCOS, but it's not impossible. The key is to focus on sustainable lifestyle changes that you can stick with long-term. Start by cleaning up your diet. Focus on whole, unprocessed foods like fruits, vegetables, lean protein, and healthy fats. And limit processed foods, sugary drinks, and unhealthy fats. Incorporate regular exercise into your routine. Aim for at least 30 minutes of moderate intensity exercise most days of the week. And don't be afraid to lift weights. Building muscle can help improve insulin sensitivity and boost your metabolism. Don't forget about stress management. Stress can lead to weight gain, so find healthy ways to manage stress, like yoga, meditation, or spending time in nature. And lastly, be patient with yourself. Weight loss with PCOS can be a slow and steady process. Don't get discouraged if you don't see results overnight. Just keep at it, and you will eventually reach your goals. Thanks for watching. If you found this video helpful, please give it a thumbs up and subscribe to our channel for more health-related content. Don't forget to hit the bell icon to get notified whenever we post a new video. Remember, you're not alone in this journey. PCOS is a common condition, and there are countless resources available to support you. See you next time.